My name is Diane Holland. I'm a clinical nurse researcher in the Department of Nursing Research Division. My clinical background is that of a discharge planning coordinator. I was a discharge planning coordinator for almost 15 years. I became interested in actually the base of evidence for the discharge planning process while I was a discharge planning coordinator, and started examining some of the pieces of the process while I was still in that role. It motivated me to move on to a master's in biomedical sciences through the clinical research training program here at Mayo, and then on to a doctoral program where I felt with proper preparation I could generate some of the evidence required to improve the practice. Beyond my doctoral program, knowing that I wanted a career in research, I completed a postdoctoral program at the University of Pennsylvania School of Nursing. My passion really lies in transitioning patients out of the hospital safely and securely, as well as successfully. So my program of research is around care transitions, and it's been mostly from the hospital back out to the community. My early work actually was on a structure of a nursing assessment, and I developed a nurse assessment instrument for continuity of care, again specifically around patients transitioning out of the hospital. That has been adopted by nursing practice here as the structure for the handoff communication nurses use between the hospital and the next provider of care. Another instance where my work has impacted practice is the early screen for discharge planning. That was developed here at Mayo, and it is currently embedded in the electronic medical record and is part of the RN admission assessment for adults here in the hospital. It identifies patients whom a discharge planning coordinator should engage early in their discharge planning process because of complexities in their post-acute care needs. Beyond Mayo, that screen is also embedded in Johns Hopkins hospitals, NYU Medical Center, and at the hospitals of the University of Pennsylvania. I've had requests not only from numerous states but also numerous countries for information regarding both the assessment structure, the assessment instrument, and the early screen. What motivates me actually to continue working on transitioning patients safely out of the hospital is every time I introduce myself to someone new and they ask what I do, I explain that I work in discharge planning research. And that invokes a comment or a story from that individual where they had someone they loved discharged from the hospital and it didn't go well. And that's been consistent for over the past 20 years. I find that motivational to actually improve that practice area. It's very key to a person's successful recovery, and we still don't do it very well. In terms of inspiration, I find the participants who are willing to volunteer into my study, regardless of multiple chronic conditions and some in the situation of end-of-life care, are willing to actually participate in research to help other people, and I find that inspires me.